Well, back to normal before Thanksgiving. That is the prediction of a prominent Bay Area doctor. He now says we could get to mostly pre-pandemic life by the holidays.
Janelle, there are a few specific targets, though, that we need to hit, according to the doctor, in order to get there. And that includes people opting in to get vaccinated. Here's NBC Bay Area's Anoushah Rasta.
President Biden held his first town hall since taking office last night and made a big promise to Americans about COVID-19 vaccines.
By the end of July, we'll have over 600 million doses, enough to vaccinate every single American.
But a Bay Area doctor is even more optimistic than Mr. Biden, calling the president's estimate conservative.
If we're really going to be at 600 million doses by the end of July, we will probably be in a place where anybody who wants a vaccine will be able to get one sometime in May.
UCSF Department of Medicine Chair Dr. Robert Wachter explains that vaccine distribution has gotten significantly better than when the rollout first started. Also, he says the Johnson & Johnson vaccine that's expected to be approved next week could be a game changer because it only requires a single dose. And there's growing research suggesting that anyone who's had COVID before may only need one dose of any vaccine. If anyone who wants a vaccine can get one in May and rolls up their sleeve, Dr. Wachter hopes for something close to normal by the end of the year.
I think by the fall, I think October is a reasonable guess that we'll get to something that doesn't feel that different than it felt before the pandemic.
But health officials say until we reach those milestones, we have to keep our guard up. That means continuing wearing a mask and maintaining social distance. Dr. Wachter says in terms of the virus, they still worry about the variants first found in South Africa and Brazil, which seem to resist the vaccine.
If those variants become dominant in the United States, then we have a problem, and that'll change the timeline because it will mean that the level of vaccination that we need in order to create herd immunity is much higher than it would be otherwise.
Anoushah Rasta, NBC Bay Area News.